Europe wants to be competitive in health, but is it really investing enough to thrive? Welcome to this special highlight show. Let's see what our experts talked about.
Everything we can do better and cheaper together, we must.
We can't do healthcare without the private sector and without private capital. That's the starting point. At the same time, I think what we do need is government capacity to guide, not to hinder.
With large pharmaceutical businesses and with a very, very strong public health care sector, that combination is exactly the right combination that could turn us into the most competitive area in the world and make sure that we continue to be the place where our citizens have the best health.
If we don't start spending more on health as a percentage of GDP than we do now, our life expectancy will go down. And that is mind-boggling in the region in the world that is best organized with universal coverage. We have that competitive advantage and we let it slip away.
You need to say, okay, now Minister of Finance, they want to see numbers, numbers, and numbers. And then you say, okay, 10% of GDP is related to health investments, 30 million employees, 8% of the exports. Then if you save up 20% of cardiovascular diseases, you get a return of 1% GDP. This makes up X% of your fiscal income of your household. And this discussions need to be done, right?
Within healthcare, there's a lot of inefficiencies that we also need to address. We need to clean up our own kitchen as well. I think we budget way too much in silos, hospital silos, other silos, and so on, and we don't look at managing diseases as a pathway from end to end. The systems are not set up like that.
We're seeing countries, developing nations, actually deprioritizing health in budgets. And that's devastating after COVID, after what we've seen.
It would be horrible and it would be a disaster, I think, for politicians around nowadays to look back 10, 20 years from now and say, oh, we really didn't get our act together. Let's get the Biotech Act right. Let's get the Critical Medicines Act all together. Pieces of a very important puzzle. Let's get it right.
What we lack, at least at the national levels, is a European vision and saying, look, let's look at it for the long term. You need to look at health not as a cost, but as an investment.
So these were the key highlights of today's discussion. Thanks for being with us.